day, ma'am. I am Artist Joy, your student nurse for today, and I'm going to do the assessment of the peripheral vascular system. So, before I enter your room, I already washed my hands. Can I sit beside you?
Okay.
So, this time, ma'am, I will be asking you questions. This time, I'm gonna ask about the history of present health concern. Have you noticed any color, temperature, or texture changes in your skin?
No, I haven't.
Do you experience pain or cramping in your legs? Kung naa man ganid, pwede nimo ma-describe sa ako ang pain, aching back, cramping, stabbing, ug how often does it occur? Does it occur with activity? Is the pain reproducible with the same amount of exercise?
No, I don't.
Okay. So, do you experience heaviness and aching sensation in your legs aggravated by standing or sitting for long periods, leg edema or varicositis?
None so far.
Do you have any leg veins that are rope-like, bulging, or contorted?
No, nothing I can recall.
So, do you have any sore or open wounds in your legs? Kung naamang gani, asa nakalocate or are they painful?
Wala man.
Do you have any swelling, like edema, in your legs or feet? At what day is swelling worse? Is there pain? Is there pain with swelling?
No.
Okay. Do you have any swollen glands or lymph nodes? Kung naamang gani, do they feel tender, soft, or hard?
No, I don't have any.
Describe any problems you had in the past with the circulation in your arms and legs, like blood clots, ulcers, coldness, hair loss, numbness, swelling, or poor healing.
Nothing I can recall.
Have you had any heart or blood vessel surgeries or treatments such as coronary artery bypass, grafting, repair of an aneurysm, or vein stripping?
No, I haven't.
Do you or does your family have a history of DVT, diabetes, hypertension, coronary heart disease, intermittent claudication, or elevated cholesterol or triglyceride levels?
Yes, my mother's sister was diagnosed diabetic. Diabetes.
So okay, this time, ma'am, lifestyle and health practices nata. So do you or did you in the past smoke or use any form of tobacco? How much and how long?
No, I don't. I don't, and I didn't.
Okay. So do you exercise regularly?
Yes, I jog every morning.
Are you experiencing any stress in your life at this time?
Due to COVID pandemic, I have been struggling.
Okay. Sa pag na klase nga struggle, ma'am?
Financial.
So, do you regularly take medications prescribed by your physician to improve your circulation?
No, I don't have any medication prescribed.
So, I'm going to start by looking at the upper extremities. So, if you could just hold out your arms, that would be great. And I'm looking at the color of your skin, and I'm also touching it with the back of my hands to check the temperature all the way down to the fingertips. Okay, and also as I move down, hold lang, ma'am, ha. So your hands, I'm also looking at the fingertips. I'm checking for capillary refill by pressing on each, down lang sana, ma'am, on each in each nails on the both hands, and also checking, and also I'm checking for the profile which I'm looking right here, the angle here. Okay. Okay, then I'll be checking pulses, ma'am. Um, I'm going to start with your radial pulses. So I'm going to check the pulses and I'm checking them at the same time so I can see if they are symmetrical. Ano lang, ma'am, straight lang, ma'am, ha? Looking for the rhythm. The rate and then the range. So this time I'm on the strength, and so this time I'm going to move at the brachial pulses. So here again I'm checking for strength and the rate and the rhythm. So I'm gonna do the same time again so I can see if they're symmetrical. Okay. This first, the color. I'm looking for the color to see if there's any lesions. Okay, move gamay, ma'am, ha? Or any abnormalities. And then I'm gonna touch it with the back of my hands and come all the way down to your toes. Alright, I'm checking for any abnormalities, particularly to the back of the legs, where if there's any varicose veins. Okay. And then I'm gonna look at the toes. I'm looking for the color of the nail bed, and I'm checking for capillary refill by pressing each nails. Then I'm gonna be checking the pulses of your feet. So I'm gonna start with the dorsal pulse. So together I'm gonna check it at the same time to see if they are symmetrical. Right on the top of the foot again. And check straight, strength, and the rhythm, and then the rate. Okay. Okay. So this time, the last pulse I'm gonna be checking is the post-tibial pulse, or the posterior tibial artery pulse again. So dali na ko siya pangitaon this area, and I'm gonna go down all the way down aning a bone. Same with the other. And then I'm gonna check the strength, the rhythm, and then the rate.